Hello, good morning. I'm Dr. Umma Karadan. Today, I want to talk on a particular condition called peripheral neuropathy. As you know, neuropathy means involvement or disorder of peripheral nerves. That is the nerves which innervate our skin, your muscles, your glands, and various organ systems. So, they usually present with a tingling, numbness, paresthesia, burning, pain, usually with the cramps and tremor and later loss of sensation and difficulty in moving the toes or weakness of the feet or weakness of the hands or weakness of any part of the body. Sometimes it might involve the nerves around in the inner cranial muscle, like the eyes can have a drooping, facial weakness, difficulty in speaking, difficulty in swallowing, difficulty in turning. So depending on the nerves may be a pure motor nerves, like for power alone, or with that's convey the sensation, the sensory nerves, or sometimes both motor and sensory nerve. Sometimes there are certain nerves called autonomic nerves which innervate our various organ system in the body, and if that's affected, the patient or the person can have giddiness, syncope, fall, or infections or ulcers, because the blood vessels or the skin may be affected because of the autonomic nervous system. Alright, so the symptoms are these: that is a tingling, numbness, motor weakness, and probably with involvement in the autonomic nervous system. So basically there are two causes. The first cause is the genetic cause or the hereditary conditions, and the large chunk is the acquired. Acquired means this due to our probably due to the nutritional abnormality, various metabolic disorders, drugs, infection, toxins, trauma, infection, autoimmune, neoplastic, malignancy. So there are so many causes which would come under the fabric of acquired. Genetics are if only a few, maybe less than 1%, that kind of hereditary neuropathies, hereditary sensory neuropathies, hereditary motor neuropathies, sensory motor neuropathies, what we call as a Charcot types, Charcot-Marie tooth. Many types, maybe 20 or more types are there. Amyloidosis give rise to neuropathy, whereas inborn errors of metabolism give rise to neuropathy, lipid metabolism, mitochondrial. So there are so many conditions coming under the rubric of the hereditary or the genetic neuropathies. But usually they'll have something called inverted champagne appearance, the wasting of the calves, as well as some abnormality of the toes, pesca cavus, scoliosis or the spine abnormality, sometimes with the visual loss, hearing loss, some cognitive involvement. But those are extremely rare. I have seen maybe 1 or 2 cases. This is extremely rare. The large majority of neuropathy, what we in our community is diabetic peripheral neuropathy. But don't think that the neuropathy is always due to diabetes. There are a host of other conditions which should present similarly, like tingling, numbness, warmth, burning sensation, weakness, difficulty in walking, and various other symptomatology that may be due to various causes like autoimmune neuropathy, vasculitic neuropathy, due to various cancer-related neuropathy, various drugs-induced neuropathy, various toxins, due to alcohol, due to various occupation like lead, mercury, any job-related like painters, smelters. So those who are in agriculture. So or those people who take anti-metabolites, like for cancer therapy, some antibiotics, many drugs. The drugs are started with antibiotics, anti-metabolites, for cardiac medication, nitrofurantoin, dapsone, many drugs which are metronidazole, misonidazole, INH, ethambutol, gold, and all. So there are so many drugs which can present with neuropathy. In those cases, you should be careful. If any symptoms occur, like any blurring of vision, dimness of vision, especially if someone is taking ethambutol, you should consult doctor and ask him to stop it or change to some other medication. Similarly, there are people who consume a lot of vitamins, like vitamin B6 excess, which also presents with a sensory neuropathy. So better to keep vitamin B6 below 60 mg per day. because the normal requirement is only 2 milligram, because some people tend to take a lot of vitamin B6 and produce a neuropathy. So anything in excess is a poison, as you know that anything else is a poison. So diabetes is one most important cause of peripheral neuropathy throughout the world, but in India leprosy may be a bigger example, but in Kerala I've seen probably a couple of cases of leprosy only, probably because most of the leprosy goes to some other for the dermatologist, for in the physician level. But of course there are pockets of leprosy in Kerala as well as in various parts of India, and you should look out for any sensory and anesthetic patch or patch without any sensory sensation, food wrist draw, food draw, facial weakness, eye problem. So you should be careful and look out for leprosy, as it is common in India. Worldwide diabetes is common because diabetes, once the blood sugar goes beyond, fasting goes beyond 126, or the postprandial goes beyond 200, or if the HbA1c goes beyond 6.5, even some people they start with the peripheral neuropathy. Even 7.5% of the diabetes can present as peripheral neuropathy initially at the outset, and up to 75% of the diabetics tend to develop peripheral neuropathy during their course. So they can present the tingling and numbness with a sensory neuropathy, sensory motor neuropathy with weakness, autonomic neuropathy with a giddiness and syncopal attack, and they'll have intercostal neuropathy, truncal neuropathy, cranial neuropathy, entrapment neuropathies, one nerve getting affected, mononeuritis, mononeuritis multiplex, sometimes radiculopathy, plexopathy, hematrophy, many types of neuropathy even in diabetes. So the treatment is simple. You keep your blood sugar in the normal range. Never ever allow it to exceed beyond a limit. Always do regular exercise, good nutritious diet, avoid alcohol, avoid smoking, and if there is a pain, you can treat with drugs called duloxetine, pregabalin, gabapentin, analgesics, but always should keep to a minimum. Okay, and if there is any food draw, we can ask for the help of a physiatrist or orthopedician or podiatric, and you can have a AFO, angle foot orthosis, or splending, and regular physical therapy. And there are lots of conditions called vasculitic neuropathies. Those they come with the pain, arthralgia, pain in the joints, muscle pain, high ESR, weight loss, anorexia, like that. And they can also have skin involvement, lung involvement, kidney involvement, or other system involvement. So in that case, we ask for an autoimmune profile or a ANA profile. If those are abnormal, there are we have to treat with the immunosuppressants and other steroids and other medication. Then we have a lot of condition called cancer-related neuropathy, like leukemia, lymphoma, myeloma, other paraproteinemias, direct infiltration, and there are conditions called paraneoplastic syndrome, because the cancer has not set in, but it would tell you, it will tell you that probably this patient might develop a cancer. In those cases, like they can present the various symptoms like neuropathy, muscle problem, spinal cord problem, brain, limbic encephalitis, many manifestations. Some of them may present with a neuropathy alone. In this case, you ask for a paraneoplastic panel and watch out for a malignancy like a small cell cancer. Okay. Then there are so many drugs and toxins and organophosphorus compounds used by the farmers and people who are in industries, various industries, painting in industries, other in industries. They are prone for the toxin related or toxic neuropathy. Then there are vitamin deficiency, vitamin B1 deficiency, B6 deficiency, B12 deficiency, vitamin E deficiency. They cannot present with neuropathy. So the condition causing neuropathy are a lot, maybe hundreds and maybe thousand, I don't know. So I can just tell you only a brief highlight of the neuropathy, starting from the genetic to the acquired. Genetics rather uncommon. Acquired, most common in the world is diabetes, but of course any renal problem, any kidney, any hepatic problem, any neoplasia, malignancies, drugs, infection, toxins, autoimmune, and various other drug or toxin related neuropathies. These are all common, and you should watch out and never ever think that all neuropathies are due to diabetes alone. Okay, and the treatment, the investigation is there are the 1, 2, 3, 4 types are there. One is the basic investigation. If the like CBC, ESR, blood urea, creatinine, electrolytes, X-ray chest and all. Let's say you look for the primary thing. If the blood sugar is high, what the HbA1c level, and then next go to the next level like ANA profile, and various other immune mediated or inflammatory mediated, sarcoid, ACE level, or paraneoplastic panel, GM1 panel or GM2 panel. So all those condition various panels are there. Phase 2, phase 4 are there. Then can ask for a nerve content study, EMG studies, nerve biopsies, CSF studies, and blood levels of various toxins or drugs. Can always do investigate for those conditions. And so the treatment would be drugs which would relieve the pain, like a duloxetine, pregabalin, gabapentin, and other simple analgesics. And of course diabetes has to be treated very well. And if there is autoimmune causes, you can treat with steroids or immunomodulators, or azathioprine and other drugs, cyclophosphamide, IVIG, plasmapheresis. So many things are there. All right. So, and if there is a food already, the food robust set in, you can ask the help of a physiatrist and try to help him with a regular physiotherapy, as well as maintain optimal diet and good nutritious diet, and avoid any risk factors or any extra toxin like alcohol, drugs and things to be introduced into the diet or in the system. All right. So today I would like to stop here because the topic is quite vast. I don't want to speak a lot because it's a topic by itself. This just to make you understand that peripheral neuropathy is a common condition. All the neuropathies are not due to diabetes. If you don't find diabetes, you have to look out for other causes like autoimmune cause, vasculitic cause, neoplasia, drug induced, toxin, genetic causes, or other various causes. Okay, and treat judiciously according to the particular clinical condition. Okay, thank you very much.